name's Rachel, and I'm one of the nursing instructors, and today we're going to talk about priming a line. So before we prime the line, the first thing we have to do is check your doctor's orders. So if you're using paper chart or online charting, you're going to look at your orders, you're going to figure out what solution the patient requires, what rate the patient requires, which will help you decide what size of bag you're going to choose. And once you've determined those factors, you're going to go and check the patient, make sure that they know they're getting an IV, and then we're going to get started with the priming. So once you've confirmed your order and your solution, you want to take a look and go and get your bag. So in this case, we've chosen a 250 bag of normal saline. So we want to make sure that it's normal saline and that matches the order. We also want to make sure that the expiry date is correct, in which case this is February 25, so we're good. We also want to look at the bag and make sure there's no moisture in the bag, that this bag isn't leaking in any way. Then you want to make sure you've chosen your primary tubing. So this is primary tubing. You can see there's 2 ports here, and here is your drop factor, which, as you can see here, is 10 drops, is approximately 1 mil. And so that's, if you are not using a pump, you would need to calculate your drip rate. Okay, so now we're going to start the actual priming. So the first thing we're going to do is do some hand hygiene. Once we do our hand hygiene, then we're going to open our bag, and we're going to do one last inspection of our bag. And that inspection is just to make sure that it's not leaking anywhere, which it isn't. We've already checked that it's the right solution and the due date, so we're good for that. So now we're going to put this up on our IV pole, and we're going to leave the cover on because that maintains the sterility of the IV bag. The next thing we're going to do is open our IV tubing, which is going to give me some trouble, but we'll get it open all the same. There we go. So once we get open our IV tubing, we want to take this paper off so that we can straighten it all out and untangle it. Okay. Now we want to take our slide and we want to push it all the way up to the top. This is for our use. So this is the top. This is your drip chamber. We want to push it all the way up to the top here to make it easier. And then we're going to roll the clamp down to make sure it's closed. So now we have our IV tubing. We're holding onto both ends, and we have our roller clamp up towards the top. Now we're ready to get started. You must clamp this before you spike your bag, otherwise you are going to get very wet. My practice is I put the end of my tubing into my bag from my IV bag so that I have a place for the water to go as I'm priming, but other people may have other practices. This is my preference. So you take this spike off, and then you also pull this off without touching either one. So both are still sterile. You're now going to grab this, put your spike in the middle, and push in one smooth motion. Now you can see there's no IV solution that came out, and that's because our IV is clamped. So now we're going to fill our drip chamber just by simply squeezing it, and we want it about 1/4 to 1/2. So that's usually where I set mine. That's my preference. So now we're ready to actually start the priming process. So very slowly, we're going to start to unclamp. And you can see here, the fluid is already starting to drip, and I've hardly even unclamped it at all. So as you get more proficient at this, you can go faster. But when you're new, you want to go quite slow because it's really important to make sure that these valves get cleared out. So as the water approaches these valves, you're going to turn it over. I'm calling it water because it could be any solution, but truly in this case, it is normal saline, and that's what's in here. As you invert, you sometimes need to turn up your IV flow, and now you can see it's coming through, and then we get to our little port here. Really important to have it upside down and just give it a little tap, and you can see the little bubble comes through. Okay. Okay, so then as we continue down, the lower down that it goes, you have to turn up your rate a bit, but here you can see it's flowing nicely. all the way down. So I'm going to open this a little bit more and follow this all the way down, because remember, we have on our primary site, we have a secondary port. So here is our secondary port, and as the saline approaches the secondary port, we want to make sure it's inverted. So in this case, I'm going to show you, even if you don't tap it, you can see that the air does still come out of the port, and then it comes to the end. Okay? So as long as it's inverted, then you know that you are getting the air out of the port, so you don't have to tap it. If you go nice and slow, like we just did here, that's going to give you a really nice prime with no bubbles. And then you just take your cap off, again, maintaining sterility of your end, and turn on your clamp. Oh, my fingers are slippery. You turn on your clamp, and then you can run a few, and you know now it's all the way to the end. So you further tighten your clamp again. And now we replace our cap, maintaining sterility, and we are ready to now take this into the patient room and attach to their saline lock. Okay, so that's priming an IV. Okay, so now we have our nicely primed line here, and we're ready to go in and attach it to our patient. But before we do that, we have to always remember to label our lines. So what you're gonna do when you label your lines, some institutions have specific labels for the line and the IV bag, others do not. In this case, because we're working out of a lab, we don't have specific labels, so I'm just going to use blank labels, but it is important regardless to label your lines. So you want to label with the date that you ran the line and the time, and that's for your line. And lines are generally accepted to be good for 72 hours if they're running continuously, and 24 hours if they're not running continuously. IV bags get the same label with the date and time, but IV bags are only good for 24 hours. At 24 hours, you must change the bag even if it's not empty. It's only stable for 24 hours. So once you've labeled your bags, now you can go double check your orders, go in and start attaching to your patient.